We are answering your questions this morning about COVID-19.
We have Dr. Tim Sielaff, the Chief Medical Officer for Allina Health here, and we've been getting great questions from viewers on Facebook and Twitter, so let's get right to it. Here is the first question from Todd. If exposed, is self-quarantine mandatory, and for how long? So say someone in your family has it or in your workplace, what's the guidance there?
Well, the guidance for sure is that if you are exposed, that you should self-isolate. And self-isolate means that you limit your contacts. Certainly don't go to work, don't go to social engagements, don't go to places where there are a lot of individuals. Stay more than 6 feet away from other people, and really try and stay in a limited part of your home or apartment. Continue the self-hygiene, washing your hands, covering coughs, not sharing towels and cups, etc., and cleaning surfaces where you're spending most of your time.
Well, Denise has a question to kind of further that a little bit. If you are self-isolating, what does that mean exactly? I mean, are you not allowed to come into contact with anybody, your own family members, if somebody comes to the door?
Yeah, it really is the case that if you're self-isolating, you should absolutely limit or eliminate your contact with other individuals. So stay more than 6 feet away from folks. Again, don't share any of your household items, and be really meticulous about hygiene, hand washing, covering coughs.
One of the things we learned in China is that this spreads in families. And one of the things that Italy hasn't been doing is self-isolation. You're still sending people home to their family, and then the family gets sick. So we got to figure that out here in the U.S. how we're going to deal with it.
And in many living arrangements, there are areas that you can sort of cordon off, whether it's a room or a part of an area of your home.
How about Kev's question? Once you get sick and get symptoms, how long before you recover?
Well, it varies. Again, most of the individuals who become ill will have a mild disease, and that mild disease will last on the order of a week or so, so several days to a week. But there are individuals who do become significantly ill and seriously ill and require hospitalization and will be ill for weeks, is certainly possible. So that's again why it's really important to be very attentive to our public health hygiene issues to try and limit the total number of people who become ill.
That's why we're doing this up front.
Yeah, this is a good question from Sean. Will elective surgeries like knee and hip replacements cancel, and when? That is a really great question, because of course, if you guys need hospital beds, what are you guys doing right now? What is Allina doing?
You know, one of the great things about living in Minnesota and in the Twin Cities is that our health systems are very collaborative, and our Minnesota Department of Health has been very helpful in working with the Minnesota Hospital Association to give us guidance and help us with planning for surges. So we have tiered plans to make sure that we have capacity to take care of a surge should that happen. So we have plans in the envelope ready to take out should we need extra beds to start to limit or eliminate elective surgery. We're not at that point yet, but we have those plans ready to pull out if it does become necessary.
James Ferguson wants to know, how big of a risk is eating in restaurants or even takeout right now? This is a tough one when they're saying we should practice social distancing. You know, do you go to a restaurant that has 40 seats? Do you want to sit really close to someone? What do you do?
You know, there's not specific direction about that right now from the CDC or the Minnesota Department of Health, but what I would say is if you are at all ill, if you've had any exposure, any risk like that, then you should isolate yourself from those restaurants so as to make sure that you don't become a vector for spreading the disease.
Well, and that's also true for the people who work at the restaurants who are preparing the food.
Absolutely.
Well, these have all been great questions. Keep them coming on our Facebook page. Dr. Sielaff, thank you so much for coming in. You're going to be joining us again at mid-morning at 9, so definitely keep those questions coming.